welcome back to Metflex and Chill. This is your host, Rachel Gregory, and I'm here with Dr. Jill Crista. How are you doing today?
I'm doing great. Thank you. Thanks for having me on your podcast.
Yeah, I'm super excited you're here. I'm super excited to talk about all things mold. It's a subject that I don't know much about, so I'm excited to learn. So, do you want to give our listeners a little background on who you are, kind of what your area of expertise is, and how you got to where you are today?
Sure. So I'm a naturopathic doctor, which means I'm trained as a primary care doctor who's also looking at things that are in the natural medicine sphere. So we combine the best of conventional medicine and the best of natural medicine. And I practice in Wisconsin, and that's Lyme endemic area. So here I was starting my practice doing primary care, and I ended up becoming a Lyme expert just because of where I was located, and also environmental medicine, because I live in a town with a GM factory, or former GM factory, and we're downstream from paper mills and all these things. So there's a lot of chemicals and farming chemicals and all these things happening in my area. And as I was going through learning about how to treat these, typically when you use naturopathic medicine principles, which is find and treat the cause, people tend to get better. And people come see a naturopathic doctor because they're willing to do homework. That I have a very select patient base that's willing to come to see me because they're saying, I don't feel good and I'm willing to do the work to feel better. I was having great success with Lyme and environmental medicine. Um, Except I had this little subset of patients that just weren't getting better. And I didn't really understand, what was I missing? What am I not doing right? Or are they not doing the plan, but they say they are? We're just trying to kind of figure it out. And in one of those patients, they found black mold in his home. And when they did remediation, they estimated it was a 12-year problem, which is a long time to be exposed to black mold. And of course, he had cancer diagnosis and Lyme on top of everything. So, very sick patient. And it got me thinking, I wonder if mold could be the reason for some of these other people not getting better. And in almost all the cases, they had either a past exposure or a current exposure to mold or a water damaged building. And that was when this big light bulb went off, and I thought, wow, I am missing mold and I don't really understand mold like I thought I did.
Mm-hmm.
And I left school, mold was kind of taught to me as an allergy, and it's so much more than that. It is that, but it's so much
Mm-hmm.
more than that. Yeah. So now I've become a mold expert and treated patients for a while with just my little mold protocol and trying to figure it out, doing the research.
Mm-hmm.
And then I had mold happen in my own home.
Oh,
It
wow.
fooled me. We moved into a relatively new home, and it didn't smell. So that's a big thing. I'm on a mission to let everybody know it doesn't necessarily have to smell moldy to be a moldy problem. And we ended up getting sick, and I didn't even catch it was happening, because when it happens to you, you
Mm-hmm.
get brain fog and fatigue, and they're all really subtle symptoms in the beginning. And so I sort of explained it all away as stress, and we just moved, and lots of
Mm-hmm.
different things that I could explain away. Maybe I'm not eating well enough, I haven't really been exercising as much, make excuses. And then when the flood revealed itself, I realized it was mold, and I knew exactly what to do. I could put myself on my protocol, my kids, my whole family, our dog, and we could get into an action plan. And that's when I realized I need to write a book, because everybody needs to know this. They need to have these tools in their own hands, because you can get better from mold without having to write a prescription. You can do it with your own tools, and it's really cool. So I wrote a book.
Awesome, awesome. Yeah, and I definitely want to dive into that for sure. I guess kind of starting off, can you chat about, exactly what mold is and like how it manifests in different areas, and then also, I mean, these are a lot of questions at once, but like just kind of thinking as someone who has doesn't think they've ever been exposed to mold, like what are again some of the signs and symptoms that you might be exposed to it, or you might be have in your home, or like how would you know if you
Those
know
are all really good questions.
sorry,
So,
there's a lot.
yeah, there was a lot in there. So the thing about mold is that, one of the things I get kicked back is, wait a minute, you're a natural medicine doctor and mold is natural. So why is it a problem? And it's a problem because mold is supposed to be out in nature. It's doing its job of decomposing what was living material into nutrients that another living thing can pick up and use for basic nutrients. It's like the digester on our planet, which is
Okay.
great outside. But when it comes into an indoor environment, it's going to start looking for the conditions that it likes to survive. And if it finds it, it'll start growing and doing its job in your house. And so that is humidity. Mold can start growing at 50% humidity or higher. And I'm not sure where you're located.
I'm in
Um,
San Diego.
in San Diego, yeah.
So,
So you
yeah.
are, yeah.
Yeah.
Midwest, also very humid,
Yeah.
Southeast, very humid. Pacific Northwest, I mean, anywhere other than desert and mountains, I guess, is we're talking
Hmm.
humidity. So mold, if it has that level of humidity and it has enough of its food that it likes to eat, which is basically formerly living material, which think of what we build our houses with, formerly living material. So it will just kind of set up shop in your house and be like, oh, okay, I guess I'll just do my job here. But when it's inside, it doesn't have the other natural factors that control mold from becoming a tyrant. So it doesn't have wind. We don't have a lot of air movement in a home. We don't have
Hmm.
sunshine. We don't have other fungal and bacterial microbes that keep it in check so that it just stays in its tidy little spot. In a indoor environment, it doesn't have those things, so it can start to grow. And once it really finds a spot, it will start to, and another mold spore comes into its area or another bacteria, it'll start to spit out these toxins to compete out those other microbes so that it can keep its own sweet spot. And again, in nature, it wouldn't be that competitive, but when it gets inside a home, that is like the best. You take something where it's just almost too good to be true, it'll start behaving badly. And these toxins they're meant for the other microbes, but we get caught in the crossfire. They're meant to
Mm.
kill another living microbe. So you can imagine that's why it's having such detrimental effects on the inhabitants of a home too.
Gotcha. Okay. And is it something that's like visible to the eye, or like where, if I was concerned with having mold in my home, like where would I look for it?
Yeah, that's the problem. And that's how
Yeah.
it duped me. Um, I had a 3-level home, a mid-level, a basement, and an upper floor, and we had mold on all levels, and there was no musty smell. And that's what's so scary. And so everyone's going to hear that and be really terrified now. And I know a lot of people also say, wait, 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 wait. I know that I've smelled mold. I know that we all know what that smell smells like. And that is a different kind of chemical that mold makes. So mold really, it's the spore is a problem because the spore can cause allergies.
Hmm.
It can also invade your body. And then there's these mycotoxins we talked about, which are like weapons. But then there's just the regular chemicals of a happily living mold, which is like microbial VOCs, aldehydes, alcohols. We're familiar with one called alcohol. It's fermented yeast, and it causes effects that are very similar to being sick from a moldy building. So my joke is breathe moldy air, get drunk, because it's kind of the same kind of
Yeah.
symptoms, fatigue, your eyes don't work right, all these different things, brain fog, causes all the same stuff. So
I see.
yeah, the symptoms then, it can look a lot like alcohol, but these mycotoxins have other things that they do to the body. They're immune toxic, nerve toxic, gene toxic, toxic to the gut, to the skin, and hard on muscles.
Mm.
That's why I'm excited to be on your podcast, because I'm like, I got to talk about muscle.
Yeah, I want to talk about that. Sure. I do want to ask you one thing first, though, that just came to mind because you did mention allergies. So, I actually have you heard of Dr. Brian Lenskis? I don't know if you've
Mm-mm.
are familiar with him. So he actually has his own podcast, Low Carb MD. But he is in San Diego. He's one of my really good friends, and he is in the low carb keto space as well. He
Mm.
um, got into low carb keto like probably 3 years ago, saw the power of it. He's a family medicine doctor, works with a lot of type 2 diabetic patients, and
Mm.
he started putting his patients on on keto and low carb, and they started having amazing results. He was taking them all off insulin, all this stuff. So we connected when I moved to San Diego a few years ago, but it just got me thinking because he was in an office here in San Diego, and he started developing this allergy to tree nuts, and he
Oh,
didn't
yeah.
know, like, and this was when he actually first started doing keto, low carb, and he thought it was a symptom. He thought it was because of that. And so he was like, wow, I mean, I guess I just developed this allergy, and it could be because maybe I'm eating more nuts, because I'm, eating lower carbs. So he stopped eating some of the other
Mm-hmm.
stuff and started eating more nuts and cheese and things like that. Um, and then he found out after, like, he couldn't figure out what it was because he never had a nut allergy before, and his lip was like he would eat a tree nut or something, and his like whole lip would blow up, and his eyelid would blow up, like a
Oh my
huge allergic
gosh.
reaction.
Whoa.
And a few months later, like he got tests done, all that stuff, and they couldn't find anything. And then he finally talked to somebody, and they were like, check for mold. And so they checked in his office, and his entire office was filled with mold. And so he left the office for like a few weeks, and he all of his symptoms are gone and all of that. So anyway, with that
Yep.
story, can you tell us like what tell us about how mold manifests with allergies and that kind of that whole relationship, especially with and he was telling me about, tree nuts and cheese, how they already have mold, like there are foods that have mold on them typically, and how
Right.
that kind of relates to it.
Yeah, totally. So the my understanding, and this is sort of just my theory after doing all the research I did and treating patients, is that when you've been exposed to the air of a moldy building, that means you're getting exposed to those mycotoxins. And when you breathe them in, your own sinus flora and gut flora, when you swallow, they start to feel like, wait, there's something, we're under threat. There's something trying to move in and invade us. Because if you think about mycotoxin as a weapon, when you smell it and your mucosa comes into contact with that, your own flora starts to feel the threat. So I kind of think of it as a continuum. Like that's the first response, and you also take in those mycotoxins. So once you interact with them on your sinus tissue and also in your lungs, they can soak into your bloodstream, and then they have to go somewhere in your body. So your body says, well, we don't want this toxin. It's a toxin. We'll just clean it out and we'll clean it out. And eventually your body can't keep up with that load. And your internal flora starts to say, I don't know what's happening, but this thing is still trying to invade. I'm going to have to make my own toxins. And so you get like almost like a fungal overburden in the body. And that's when that continuum gets a little farther down the line. The fungal overburden then means that anything else that's in that fungus family is going to feel like further invasion. And so you
Okay.
see, and so that's one possibility. The other is that if you've already shelled a nut, or if you've grown a grain and mass stored it, they get moldy. And so there
Mm-hmm.
could be actually mold on the food too. Yeah. So then
So
the body is just like, I can't, and you'll have
yeah.
a whole, if you're healthy, you have a whole huge reaction. And that's a vital response. But people that are, maybe they have a pre-existing condition, or their nutrition isn't that good, or they just don't have that vitality, they're just going to kind of get wimpy sick. Like, so
Okay.
that's when you're going to get the people who they can't sleep, they have terrible insomnia, they don't have energy to exercise anymore, or when they do exercise, they're more tired out from it, or they don't see the gains of the exercise. It's been
Mm.
fun listening to your podcast to hear, all these things about like how to gain muscle. And, I
Yeah.
mean, it's been great because muscle is medicine. Dr. Tina Moore has just drilled that into my head. So if someone is working really hard in the gym, sometimes that's the only sign you see in a man, is that we see a testosterone drop and a skeletal muscle drop.
Huh.
And they did nothing different, except
Because
move
they're
into
exposed to
a,
mold.
yeah, right.
Wow, that's crazy. So
It
I
is
do want
crazy.
I want to dive into that, but so I'm just this is kind of fascinating to me because could people who start to develop these weird allergies to nuts and maybe other foods that are usually have are more predominant in being able to develop mold, like you said, shelled nuts, if you store them, like they can
Sure.
develop mold.
Yeah.
um, are there other foods like that? And then also, is this something that you've seen a lot where people, they develop this weird allergy of they have no idea where it's coming from? Is mold typically something that, like, the
That's on my
reason for it?
differential, definitely. So a
Okay.
new onset something allergy.
Okay.
I've had multiple cases where someone had a new onset grass allergy. So they, lived in the same house, and then it had some water event, like the washer overflowed, or the little water line to the refrigerator was leaking and they didn't know it, and then they finally discovered it, something like that. And if family members take on a new allergy, so it could be grass allergy, pet allergy, where they had no problem with those things before, food allergy, chemical sensitivity, something that's new to them. And with mold, if the exposure is significant enough, that can show up right away. But usually it's going to take like 3 to 6 months for that to show up after being exposed, or, through exposure. So that definitely, when I see that, I'm like, so you're telling me you could eat dairy, all your life. And now, since you've taken this new job, or, since this water event in your house,
Mm-hmm.
now you can't have dairy. Let's start to put some things together. Yeah.
Interesting.
Mm-hmm.
Super interesting. I didn't even think about that until after he told me that story. I was like, wow.
Yeah.
Um,
Yeah,
but
so it
yeah.
could be the mold in the shelled nuts, but it also just could be something that you're exposed to on a regular basis. And
Mm-hmm.
because the body is in that like defensive mode of I'm being invaded, it will start to question and tag everything that it sees on a regular basis. So it could be, I've had patients become allergic to apples. I've had patients become allergic to beef. I've had patients, it's just something that
Interesting.
they were eating on a regular basis suddenly they couldn't tolerate.
Interesting. So that would be like a sign, just like an allergy out of nowhere would be a sign of
Mm-hmm.
toxicity. Okay, it's crazy. Okay, I do want to, yeah, I want to dive into kind of how it can manifest with like muscle. Like what's the relationship between mold toxicity and maybe, like you said, not seeing the product of the work you're putting in at the gym with building muscle and all of that.
So all of these mycotoxins I was talking about, the weapon ones,
Mm-hmm.
they all impede protein synthesis in the body. So you can eat the protein, but ultimately you do need to convert that into something called skeletal muscle. And if you have this toxin sitting in the way, you can put all the right types of amino acids into your body. And let's assume you're absorbing it through the gut first, because that's another discussion that mold causes. But um, let's say that you're doing, hydrolyzed or pre-digested proteins, and you're eating all the right things, you're eating at the right time, you're getting it into the body. But then if you have the toxin sitting there, it can't manufacture into skeletal muscle, into smooth muscle, into keratin and elastin in our skin and hair, into heme, which carries iron around through our body. That's part of the whole hemoglobin. DNA, RNA, enzymes. These are all proteins in the
Mm-hmm.
body that have really important jobs, and mold just blocks the production of them. So depending on which mycotoxins, some of them do it harder than others, but all of them impede that protein synthesis. And then there are some that are really hard on the endocrine system.
Mm-hmm.
So they will actually cause degradation of the testes. So we see a low T, or low testosterone, in men who've been exposed. And it's really interesting when like, the typical picture of a family is the child and the woman are going to be the first to react in some way. And for the woman, it's probably going to be more neurological or endocrine. So the cycle starts to get off. You start to get premenstrual symptoms. For a child, it might be attention deficit issues, sleep issues, wetting the bed. For the woman, it might be frequent urination. There's a lot of urination issues and urinary tract issues with mold. And then the father, who doesn't have as much body fat, so he's not accumulating these toxins, typically says, I'm fine, but they start to get irritable and they start to show signs of low testosterone and insomnia. And then, over time, you see the skeletal muscle depletion. So it's just very interesting how it can look.
Wow.
It can cause on the mold mycotoxins because they're fat soluble. That means more than love handles. That means, brain soluble, bone marrow soluble, immune system soluble, organs, and our gut lining.
Mm-hmm.
Because they can go to all those places, they can cause almost any symptom. So it's hard to know. You said, how would I know if I couldn't see mold? Because remember, mold is microscopic. So you could
Mm-hmm.
have a problem. It could be growing behind the walls or under the flooring. And you may have some symptoms that we're calling adrenal fatigue or thyroid disorder or food allergies, or you name it.
Mm-hmm.
Um, it is a little tough to know that it's mold. I mean, it even tricked me.
Yeah. And is
So,
there, oh, sorry.
yeah, no, go ahead.
No, I was just gonna say, is there any way to like test for it?
Yeah.
Like,
So
okay.
I'm on a mission I created a questionnaire for myself in my own clinic because I was having a hard time telling the difference between people who had Lyme disease and mold. Like when is the mold the bigger barrier to them getting better than the Lyme? And that was hard for me to discern in practice. So I created a clinical questionnaire and I put that in my book. If anybody wants it, they can go to my website. There's a way to get it on the website. Um,
Okay.
and what it does is it gives you a score of, it's basically, moving the needle. So it's probably not mold, possible mold, and then probable mold. So it gives you a number, and then that gives you an idea. And I'm working hard to scientifically validate that with testing to show that, you don't have to spend a bunch of money on a test. You can just fill out the questionnaire. For me in practice, it was a very reliable tool. So you can
Interesting.
do the questionnaire. I also have a quiz on my website on moldquiz.com. You can also go there. And it's kind of a fun quiz because it teaches you about symptoms that a lot of people didn't know were mold, like ear
Mm.
ringing, irritable bowel syndrome, some of these urinary frequency. So people learn a lot about mold. I've gotten so many emails. I never knew that was mold, until I
Yeah.
took your quiz. And so the quiz gives you a score also. It's a short form, not really the clinical beefy one that I have in my
Hmm.
book, but those are just some like little tools that are out there if people are interested. You
Okay.
can also test for it, but the testing still has some limitations. Dr. Shoemaker, which I am not a Shoemaker trained doctor, he was able to find like indicator labs that show that your body is inflamed about something, and that if you have this certain set of these indicators, it's pointing more arrows toward mold. But those tend to be really expensive tests, and you have to do the whole panel to get the picture. Another innovation that's come out is excuse me, urinary mycotoxin testing. So back to the idea of how do we get mold and mycotoxins in our body? When you inhale them, they go to your lungs, which goes to your bloodstream, which ideally goes to the liver to get all packaged up in bile, and then we poop them out is the idea.
Hmm.
But the other way to get it out is to go to the kidneys, because kidneys filter toxins out of our blood. So the urine tends to be a really good way to find if a person has mycotoxins floating around in their blood. And I've found this to be a really useful test clinically, because typically the levels are high when somebody's really sick, and as you get them better, the levels go down. So it correlates up and down. But there's some limitations with the test that if you're eating a lot of mold, it could show up in the urine too.
Mm.
So I put
Is it
people
a
on a low
specific
mold.
test? Oh, sorry.
Yeah.
Is it a specific test for like for the urine? Is it called something specific, or do you have to? Sorry,
Yeah.
I just lost my train of thought. Is it
Yeah.
called
No,
specific, or do you have to like have your doctor order it for you, or can anybody go and get the test?
I am so glad you asked that question, because I think people end up listening to podcasts and then they get frustrated. They're like, how do I get the test? You do
Yeah.
have to have a doctor order it.
Okay.
And the urine mycotoxin test is not your typical MD
Mm.
standard lab. It's going to be something from labs that are out of the normal, like HMO kind of thing.
Mm-hmm.
So the companies that I use are Vibrant Labs and Great Plains Laboratory, and that's
Okay.
using something called a mass spec method. And then if somebody has to be on certain supplements, then I use a different method by Real Time Laboratories. So
Okay.
there's some nuance there of what you pick and when, and we're still trying to figure all that out. Even we doctors are arguing about all that.
Gotcha, gotcha. Yeah,
Yeah.
no, that makes sense though, and I think, like you said, place to start would be to go to your website, and I'll link everything you mentioned in the show notes so people can go click on that, take the quiz, all that, maybe start there if things are popping in their head as they're listening to this, like, oh no.
Yeah. Yeah.
um,
Yeah.
so that'll be super super beneficial. So I guess, and I know this is what your book is all about, but maybe once someone realizes they may be exposed to mold, like what do they do? What's
Yeah.
kind of, I mean, I know you've developed a whole protocol, but maybe you can give us like a short synopsis of that,
You bet.
or okay.
Yeah. Yeah. I love to do short synopsis, because if you are sick from mold, your brain is foggy, and again, think about a drunk person. Like the retention
Yeah.
is not there. Yeah. So the attention and retention is not there. So as easy as we can make things, the better. So what I developed as far as the protocol is really first and foremost a therapeutic order. And this I learned by making people worse, trying to get them better. So I tried to make sure that first and foremost, avoidance. And that was what my teacher, Dr. Walter Crinian, he said, the first 3 steps to any toxic exposure is avoidance, second step, avoidance, third step, avoidance. Get the picture? It's so important. And, once you write a book and you become the expert in something, you get everybody's patients that weren't getting better and they were doing everything right. And so many times it's because the doctor wasn't pushy enough about making sure the patient got out of their mold problem, either remediated and made sure they retested, or because that's something people don't do, they remediate and trust. And I never do that. I always have it retested afterwards. Or, if it involves a workplace, making sure that that mold exposure is gone, 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 gone. And you'd be surprised, all these doctors that are sending me patients that they've done everything right. That's the one thing that was in the way. So the first thing is avoidance. I take avoidance to a bigger level than just getting away from the moldy building, because like we talked about, with your friend who was just blowing up from nuts, I take away all the other mold and fungal things that might be coming into that person's diet or hobbies or habits or environment. So if you're a brewmaster on the side, you got to take a break from that, And then there are certain supplements that I avoid that are going to be more fungal in nature, which is very different from what a lot of mold treating doctors do. But I've just found that it makes my patients worse to put them on yeast and kombucha and things like that. They just don't feel good.
Are there, sorry, I'm interrupting you, but are there like your top kind of foods that you take out?
Yeah, yeah. And this is why I think people that are going keto are feeling so much better, is we're taking out not just the grain, but the grain probably had glyphosate on it, pesticide, and the grain probably had mycotoxin on it. So mass produced grains that are made more locally, if you know the grower, and like our grower in our area is organic, and he puts everything in the freezer right away and then sells the flour and, pays for freezer, which a lot of mass manufacturing is not doing. That is fine. My patients are doing fine with his grains. So I think it's also, the how we treat the plants and animals, which is, I'm not saying anything new for this podcast. So grains would be number one. Cheeses, things that are mold, so mushrooms, cheeses, and again, yeasts. So baker's yeast, nutritional yeast, brewer's yeast, alcohol. That's a hard one because that is a mold toxin. So you're just adding to the burden to the body. And interestingly enough, a lot of people who are exposed to mold tend to crave alcohol, even though it makes them feel worse. Because I think it's that thing of like feed a little hair of the dog kind of thing. I think it's really interesting. It's anyway, and it's probably
And would
some
that be
candida
with
overgrowth.
this? Oh, sorry. Would that be the same with some other foods too, like
Oh
craving
yeah.
cheese? And
Oh
well, I
yeah.
mean, I don't know. I feel like cheese is not a good example because who doesn't crave cheese all the time? I mean, like I crave cheese all the time.
Yeah.
But like I don't know, nuts or things like that.
Yeah,
Would that
sure.
be
Because I think
okay?
that when you do have an inflammatory reaction, you get a little endorphin rush. So I see that a lot in my patients, even that aren't mold sick. They crave the thing they're allergic to because it creates an inflammatory reaction. So I think that's just kind of a normal food sensitivity thing, Yeah.
Yeah.
So
Interesting.
yeah, I take like any kind of yeasted food. So that means baked goodies, bread, and the grains, we take those away. And then things that tend to have more mycotoxin contamination. So corn, potatoes, soy is another big one. Peanuts. Peanuts I haven't met a non-moldy peanut yet. I test food all the time. I'm always like dipping swabs and things and sending them to the lab because
Yeah.
no one that doesn't have an interest in that food by manufacturing it is testing it. So
Yeah.
yeah, I'm always testing it, and there hasn't been one non-moldy peanut yet. So
Yeah, is
avoid
that
them.
something? Is that just peanuts or like all nuts? Because I keep all my nuts and seeds in the fridge or freezer to
Yeah,
help prevent
excellent.
with that. I know
Yeah,
a lot of people just store all their nuts and seeds like in their pantry, which is no, right?
Yeah, that's right. That's a thumbs
Okay.
down. Yeah.
Are there any other like common foods that people store in their pantry that should probably be storing in their fridge or freezer to help prevent mold?
Grains and flours. How
Okay.
many times do you think about putting a bag of flour in the freezer?
Never.
People just don't. I wasn't raised with that. I was raised
Yeah.
with flour was in the big canister thing that you
Mm-hmm.
flip the swing top lid, and that's how you got flour. And no, that should be in the freezer
Yeah. Yeah, I
and
don't
keep
keep
it
regular
fresh.
flour in my house usually, but I have like almond flour and
Yeah.
coconut flour, and that's all. Like I have a huge, like my fruit drawer in my fridge is just all nuts and flours. um,
Nice.
so yeah, that's something that, and I didn't even think about that until I think I heard like a few years ago. I was just learning a little bit about mold and how it manifests and all of that. So that's a good tip if anybody's listening. They're like probably running to their pantry right now.
I know.
um,
Yeah.
so yeah, sorry, I interrupted you, but you were talking about before I interrupted you about the question about the food, kind of the protocol.
Yeah.
Yeah, we
The,
maybe we
the
could just
therapeutic
continue. Yeah.
order, yeah. So for me, it's kind of comes down to 5 general methods. So the first
Okay.
is avoid, second is fundamentals, then protecting your body from more mycotoxin, then repair, and the fifth is fight the mold. And I used to, when I first figured out, like the guy I was telling you about that we found out it was mold, and I was like, oh, he needs antifungals, and like put him on a bunch of antifungal, just even plants. And he got so much worse. Like his gut got worse. He had terrible urinary frequency, he had terrible ear
Wow.
ringing. His insomnia was horrible. His anxiety went through the roof. And I was just like, oh, what have I done? I did just the wrong way. But he was still in the mold as well. But I was like, it's okay. We'll protect you while you're getting your remediation plan. And yeah, no, I'm much more careful now. So that's why I
Mm-hmm.
kind of put the fighting mold last, because we've seen in studies that when you administer an antifungal to mold like aspergillus, it will kick up its production of mycotoxins in defense. And so you have to kind of know that then when you start to do the antifungals in the fight phase, that final phase, you have to have your body pretty ready to handle more burden like that.
Mm-hmm.
Yeah. So that's the general outline, but I mean, avoidance is clear. It means
Mm-hmm.
get away from moldy things and moldy environments. Fundamentals would be anything. You come to a naturopathic doctor and you're going to get what we call basic treatment guidelines, which is good clean living. It's
Mm-hmm.
like be on a circadian rhythm, drink water, breathe air. So many people don't
Yeah.
breathe. And diet, good healthy diet, organic food. If you're doing protein, if you eat animal protein, make sure it's clean and it's ethically raised, and all these things that are going to be shown that it matters a lot in the nutrition of that food if we
Mm-hmm.
were just looking at the right things. So those are kind of that's number 2, the fundamentals. And then 3 with the protect, the essence there is good fats. Like these mycotoxins are fat soluble, so drinking a bunch of water isn't going to help that particular toxin. So you have to dilute it out with good fats. So I have a little rhyme that, again, Dr. Kearney, and the solution to pollution is dilution. And so if you're going to dilute a fat, you need copious, clean, correct fats. And so I just put people on tons of good fats.
Hmm.
And it's amazing, like brain fog clears up, anxiety reduces, we just don't get enough fat.
Do you prescribe like or suggest a ketogenic diet or anything like that with some of your
Sometimes,
patients?
yeah,
Okay.
yep, sometimes. We have to go kind of slow with it sometimes, because then
Mm-hmm.
if we do have a candida overgrowth as well, they can get
Mm-hmm.
massive die off, and then that adds to the toxin burden. So
Okay.
it's that the thing with writing a book is you kind of take all the normal people that fit under the bell curve, and it's like, okay, what worked for them? And then of course in medicine or coaching or anything, everything's
Yeah.
individual to the
Oh yeah.
person. So yeah.
Yeah,
Yeah.
100%. We talk about that all the time.
Yep. Yeah. So the
100%.
good fats, way more fat than you think because you're trying to dilute that. And then 2 other key factors there is tons of bioflavonoids, which is the colorful pigment in vegetables and fruit. But I do try to minimize fruit with my patients. Again, just because it can overgrow fungus, if you get
Mm-hmm.
too much fruit. Um,
What fruits would you suggest? Like
Anything with
typical?
color. Yeah.
Okay.
I definitely, each color band of the rainbow does something different and specific for mold in the body. It cleans out a mycotoxin, either a certain mycotoxin or it cleans it a certain way. or it will clean out a certain area of the body. So I try to say, okay, look at your vegetables, get 5 to 7 servings of vegetables a day. Look at the color band that you typically eat. And if you're really bad at a certain color and you can get that in a fruit, then eat the fruit in that color. So it just kind of makes it, it's sort of a color game then.
No, yeah, I like it. It's easy to understand.
It's easy, I know. And
Yeah.
then if you can't get, like, if there's something you're really bad at, like you don't like squash and carrots, then, you can take beta carotene. You can, so you can take it as a supplement. And what I've found is that the mycotoxins destroy the gut lining so much, like it can actually cause ulceration and die off of your gut lining. So you see, our gut is supposed to have like all these fingers of absorptive surfaces.
Mm-hmm.
And when you see someone who's been exposed to mold toxin, they actually have like a flattened wall. They don't have all those absorptive surfaces anymore. So that makes them almost supplement dependent in the beginning, so that we can get enough nutrients in there to protect their organs of detoxification. So that, and
Wow.
then the third, I was kind of running through what I do. The third thing in that protect phase is making sure that they're moving bile. They can make enough bile and they can move it. So I use something called pre-binders. In mold, you'll hear a lot of like binder, 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 and that's a
Mm-hmm.
shoemaker protocol thing. I feel like if what we're trying to bind is bile, because that's what's carrying it out in the poop, there's been lots and lots of studies that show that insoluble fiber does that. So I make sure that people are always adding seeds to every meal, like sprinkle a few sesame seeds over something, have some pumpkin seeds with your granola, and you have them, just put seeds everywhere, pine nuts and sunflower seeds. And then you're getting enough insoluble fiber that you're binding bile. You can do it through food.
Love it. Love it.
Yeah.
Cool.
And then
Cool.
the repair is trying to repair the organs of detoxification. And I really rely on plant medicine at that point, herbal medicine. They are fantastic. Things like milk
Interesting.
thistle and turmeric. And yeah, they're perfectly made for this problem.
Interesting. Are there like top? I mean, you probably have to go into specific protocols and read your book
Yeah, right.
for the specifics, but there's specific like herbal remedies or anything, or like maybe your top one that you would use.
Milk thistle would for sure
Okay.
be my top one because it has been shown in actual mycotoxin studies and we have a dose. We know what a minimum effective dose is. So as I write in my book, that's 750 milligrams a day that you can actually be taking that and go into a moldy building. And it's been shown to protect the liver cells, the hepatocytes, and some genoprotective effects of the cells. So all the remediators that I work with, I'm always like, are you taking your milk thistle? Are you taking your milk thistle? Are you taking your fish oil? Are you taking your fish oil? Because the two work so well together to preemptively protect from a known upcoming mold exposure. So it kind of like covers the bases on that just in case thing, And people like right now, coronavirus, people are told to stay home. Well, what if your home
Yeah.
is your moldy space? And so that's another one that I'm like, well, just take milk thistle, it
Yeah.
would help. So my patients that are in a
Interesting.
moldy home, we have a whole protocol of things that have been shown to protect from the mycotoxins invading the cells.
Interesting. Wow. Okay.
Yeah.
And all of this is also in your book too, like
Yep. The
more
milk
detail.
thistle is, yeah, the
Okay.
things about, what if I'm stuck sheltering in a moldy place? That's kind of stuff I'm just working with my patients on because it's more individual.
Gotcha.
Yeah.
Gotcha. Okay.
Yep.
And then I guess this is just one question thing in terms of like testing, because you talk about testing and retesting mold in your house or testing to see if you even have mold. I don't know if we touched on this, but is there like a specific way to test if you have mold in your house or, and then also like how often you would want to test?
That's such a hard question to answer because every built space is as individual as a body. And I'm sure with working with people, it's like everybody is a little different. You're like, well, wait, why did that work for that person, but that's not working for this person?
Mm-hmm.
Same thing in a building. So there are people that swear by, oh, you have to do this test. You have to do an ERMI test, or you have to do what's called an EMA test, where you take the ERMI plus you look at mycotoxins in the dust. What I recommended in my book was the dust test for mycotoxins because at least it tells you if there are mycotoxins afoot. It doesn't
Mm-hmm.
tell you, is that a now problem or a was problem?
Oh, okay.
So unfortunately, and same thing with urine mycotoxins. That doesn't tell you if you're actively being exposed, or if you were exposed and now your own body, that building has moved into you and you're the sick building. So the testing is really nuanced. I wish that I could give you just like a simple answer.
Yeah.
But I would say that most of my patients are using a combination of ERMI and mycotoxin, which again is called the EMMA test from real-time labs.
Okay.
But there's some art to doing it. And I am much more a body expert. And there are people who spend their whole life's work on figuring out how to test a building for mold. So I highly, highly recommend to everybody, trust the experts, hire them, trust them. They can advocate for you. So, let's say someone takes the mold quiz and it says it's mold. Okay, then now take my clinical questionnaire so it's more detailed. And if it says mold, then hire a professional because they can advocate for you with your insurance company. They can help you find a remediator in your area because they know who's doing good work. The ones that are doing the inspection pre and post testing, they know who they're getting good numbers from. So they know who's in your area. So get a personal recommendation on a remediation company from them and then let them drive that bus because you need to be working on your body.
Gotcha. Okay. No, that's amazing advice. I love it. And then I guess kind of I have two last questions because I know we're getting a little bit long. Well, not. Do you
We're
still
doing
have a
all
few
right.
minutes?
Yeah.
Okay. Awesome. Just before I forget, so in terms of okay, so you answered the testing question. What about okay, you find out you have mold in your house, and then you get out and you stay and go stay in a hotel or something. Like, how long is generally the time frame, or is it always different for everybody just till they can get the mold, you know, out? Is there like a time frame for when you should stay away from it, like a few weeks, or is it different for everyone?
Totally different for everybody. Typically, we say because it's so overwhelming to even think about the fact that your sanctuary and your nest egg, and people are very resistant to the fact that it could be mold because it impacts so many different things. It's impacting all those things, finances, home disruption, just the whole thing. And I know because I've been through it, not only with patients. I mean, thank goodness I had gone through it with patients before I had to do it myself because I didn't have to spend so much time in that like freak out paralysis that happens a lot of times. So typically then I tell my patients, they're super overwhelmed by it. And I say, just at least go for a weekend and just pay attention to your loudest symptom. So whatever that is, if it's anxiety, if it's insomnia, if it's, chronic gut problems, if it's a bloating, if it's a food sensitivity, headaches. I mean, it could be all kinds of different things. Pay attention to the, first I ask them what's their loudest symptom. Okay, let's give it a number of how bad is it on a scale of 10. And then you keep that with me. And then you go stay somewhere else for the weekend. And typically a hotel's not the best option because they're so moldy too. They tend to be
Yeah.
try and go stay with a friend and not in their basement. Stay on their couch on the upper floor. And then let's just, when you come back into the space, after 24 to 48 hours, let's re-rate that. So when you're out of the space, re-rate it. And then when you come back into your space, let's re-rate it again. And it's amazing how many times something that was rated as a 6 out of 10, when they were out for the weekend, at the end of the weekend goes down to maybe a 3 or a 4. And then when they come back in their space is now an 8 because their body had a break. So if we see that dip, and it doesn't even have to dip, but if it goes up higher when they come to their home, now we know we have a home problem. And for some people it can take 2 whole weeks, sometimes 6 weeks for them to be able to feel better being out of the home. Some people really never feel better. There was an occupational study that showed that only half the people that got out of the workspace felt better when they got out of the workspace, and they needed treatment. That's why, they needed their body reset again back to normal.
Yeah.
Yeah.
Wow.
Yeah.
Wow, that's a lot.
But I know it's so, I know people say, how can you be so happy when you deal with such a serious, scary topic? It's because I know there's solutions,
Yeah.
I see people get better all the time. And the idea that this is a life sentence, or it's just not the case. But you do have to take it on,
Yeah.
take it on like a champ.
Yeah. No, I love that. I love that. I do have one kind of last, well, not last question. I have a last question for you. And then just in terms, so we did talk a little bit about how mold impacts protein synthesis. And I can never say that word ever, protein synthesis.
It's hard. Yeah.
It's a hard word to say. And
Uh-huh.
I say it like, I've probably said it like 100 times in the last 2 weeks, and I still can't ever say it. But have you had any cases in terms of, because a lot of the clients who I work with come to me, like a lot of my one-on-one clients, and obviously like one of their main goals is they're looking to lose body fat and build muscle, and kind of that's like, the realm of, work with a nutrition coach. That's, what they're looking for. And within that, I'm obviously helping them do that, but at the same time teaching them about, overall health and nutrition and lifestyle and all that stuff. But in terms of like the body fat part of it, have you ever had or ever seen cases of people, you know, doing all the right things in terms of trying to lose weight or lose body fat, and mold being one of the things that's kind of that blocker with that?
Absolutely. Yeah. And if you think about back to the idea that a mycotoxin is fat soluble, so your body will try to protect you from that. If it can't keep up with the detoxification rate of the amount coming into your body, it will find fat to store it in to protect you. And I've had many, many, many cases where people, once they got out of their moldy environment, they were able to drop 10, 15 pounds. And it becomes this kind of sarcopenic obesity kind of thing, because you're not only needing more fat, so you start to get that conversion or marbling of the skeletal muscle so that the body has more places to stash mycotoxins. And you're also losing, skeletal mass, which is your burner fuel, so yeah, it's very, very common. There are cases where people start to lose a lot of weight and they get too thin. But I would say that's going to be the rarer case in the United States or any well-fed, westernized, country, Australia, UK, and Europe, and that kind of thing, where it's usually going to be a weight gain.
Interesting.
Mm-hmm.
Wow, I've learned so much in the last 50 minutes, and I
Oh,
know our
I'm
listeners have too.
glad.
So I always kind of end my podcast with a question, or a few questions, but I'm going to ask you one specific one today. So is there anything, this doesn't have to be mold related or anything, it can be anything at all, but is there anything that you've changed your mind about in the last year, and why?
Yeah, this is an interesting question. So I think it's kind of funny. I hope, well, it's funny to me, is that I realized that 80s music isn't all that bad, actually. And that's a random sentence, but
No, no.
I love like living room dancing, and it's one of my things. I love to dance, and my kids are now 20. I have twins, and we have this tradition where we play music for each other at dinner time, and they're starting to play like 80s music. And as we're dancing in the kitchen, I'm like, this was really good, actually. There's a long time I always thought that was kind of cheesy music, but it's really fun to dance to.
Huh,
So yeah,
it's funny.
that's a random one.
No, I love it. I love it. I haven't gotten that into 80s. I don't know. My music is just all over the place. Everybody asks me like, what's your favorite type of music? I think our friend Eric asked me, and I was like, I don't know. I mean, I love hip hop and that type of music,
Yeah.
but I don't really have like a favorite. I have,
Yeah, like a thing.
yeah,
Yeah.
yeah. But
I'm the
cool,
same way,
cool.
but yeah, I kind of had written it off, and I'm just rediscovering it now, and I'm like, oh, this is really fun.
That's awesome. That's
Yeah, so that's
awesome.
not about mold at all.
No, the question is really just anything. So
Mhm.
awesome, cool. All right. Well, do you want to tell our listeners again? Tell us the name of your book, maybe where they can find your book, and then also where we can find you, maybe your website, social media, anything like that.
You bet. So my book is called Break the Mold: 5 Tools to Conquer Mold and Take Back Your Health. And my website is drkrista.com. That's drcrista.com. I have tons of video blogs. I try to keep them short, like Instagram size, like a minute or less. And again, because people with mold sickness have very short attention span and brain fog. So I try to pick one topic and just hit it in a minute. And you can get all those on my website. And I'm on Instagram and Facebook at Dr. Jill Crista.
Awesome, awesome. I'm definitely going to be diving into that. I actually already ordered your book yesterday on Amazon, so it is
Oh,
hopefully
awesome.
Amazon's pretty fast, so hopefully it should be here tomorrow. But yes, I will link all of that in the show notes so our listeners
Great.
can can find that, and definitely recommend. I'm going to go take the quiz actually after we sign off,
It's fun to do,
because
it's just one of those things that it's like, whoa, I didn't know that was a mold thing. And yeah,
yeah,
yeah.
yeah, and
And
just
then,
like to learn and be aware of it too. So
yeah,
awesome.
yeah. And then when you work with other people, you can see those trends then,
Yeah,
you
yeah,
can catch it. So, and then I
for
do have a
sure.
practitioner course where I'm training other practitioners. That's really my mission, is to increase the amount of mold treating doctors in the planet and people that have that literacy. So I have a mold literacy training course where you can become mold literate certified if you're like a primary care doctor.
Hmm.
And that is on my courses tab. It's called Are You Missing Mold? Because I
Okay.
was. And I think a
Yeah,
lot
and
of
I mean
doctors
it's
are.
something. Yeah, and it's something like when I'm just thinking about all of my clients and past clients and things like that, and like just thinking about allergies and not being able to lose weight and insomnia, not being able to sleep, like all these things are running through my head.
Mhm.
Like wow, I didn't even think about that. So
Yeah.
definitely going to be a tool in my toolbox to make sure I think about if any of the things that we talked about, any of the symptoms kind of come up. So super
Awesome.
interesting.
Wow, that just made my day. That's great. I'm glad.
Thank you so much for coming on. I really appreciate it, and I'm excited for listeners to hear this.
Thank
So
you.
awesome. All right. Well, I hope you have a great rest of your day, and I'll talk to you soon, hopefully.
Thanks.